Are you experiencing changes in vision due to glaucoma? Have you experienced recent kidney damage resulting in difficulty urinating? Were you involved in a recent accident leading to increased intracranial pressure, experiencing things such as headaches? If you're experiencing acute renal failure, glaucoma with increased intraocular pressure, or increased intracranial pressure, mannitol may be the treatment for you. Mannitol works in the kidneys as an osmotic diuretic, and it acts mainly in the proximal tubules and the loop of Henle within the kidneys. And it causes an increase in the osmotic force within the glomerular filtrate. And this leads to increased reabsorption of water and electrolytes. So your body is excreting more water and more electrolytes. Mannitol can treat acute renal failure, and the way it does this is it promotes the excretion and reabsorption of water and electrolytes within the kidneys, and this will maintain urinary output. Mannitol can also be used to treat glaucoma with increased intraocular pressure, and the way it does this is by decreasing the intraocular pressure by reducing the production of aqueous humor. Mannitol is also used to treat increased intracranial pressure by removing the excess fluid from the cells within the brain. Brand names include oximetrol and resectosol. And as the healthcare provider, you want to make sure you're educating your patient on the side effects. Dehydration, such as dry mouth or decreased urinary output, is a side effect. Electrolyte imbalance symptoms, which I will go over in the next slide. And if they have pre-existing edema that begins to worsen, this is a side effect of mannitol. Seizures and tachycardia are also side effects of mannitol. So if you begin to experience any of these symptoms that I have listed below, then this could be a sign of an electrolyte imbalance, and you should notify the healthcare team immediately. Nausea, abdominal cramping, fatigue, weakness, confusion, anorexia, numbness, diarrhea, tingling in the finger or toes are all signs of an electrolyte imbalance and should be addressed immediately. And as the provider, you want to make sure that you're assessing the history of the patient you're giving this medication to, because a pre-existing history of renal impairment or untreated dehydration or decreased or no urinary output or a history of hypersensitivity could all be potential problems when administering mannitol. As the nurse, you want to consider a few key things I have listed on the screen. You need to think about the timing of when you're giving mannitol. Mannitol is a diuretic, and this makes the patient urinate. So you probably would like to give mannitol in the morning. Your patient would appreciate that. Instead of being up all night diuresing, this leads to changes in sleep pattern and dangers of falls. You also want to think about monitoring their fluid volume status. You want to do daily weights, and a change in weight by 2 pounds, whether it's an increase or decrease within a 24-hour period, should be reported because your patient may be experiencing a fluid volume imbalance. You also want to assess their neck veins. Jugular venous distension or flattened neck veins could also be a sign of a fluid volume imbalance. You want to monitor their urine output. A minimum of 30 milliliters per hour is expected, and the urine should be clear and yellow. Any other characteristics should be reported. You want to also assess your patient for signs of hypotension, because they may be experiencing orthostatic hypotension, and this can be because of the depleted intravascular space, and this puts them at increased risk for falls.